Hi, my name is Dr. Katie Jarvis. I am so excited to welcome you to the Healthcare All-Stars podcast, where we talk about important issues that are pressing for our society, including efficiencies, quality, and delivery of amazing healthcare. Today, I'd like to welcome our special guest, TJ O'Reilly, CEO of Dallas Behavioral Health.
Thank you.
Thank you for coming and being on our show. TJ has an MBA from Franklin University. He has a bachelor's degree in psychology from University of Montana and also an RN from Casper University. You are the most highly qualified person to answer any question in behavioral health. That's just amazing. So you bring to the industry an expertise from a nursing standpoint, a psychology standpoint, and a business standpoint to answer questions in unique ways. You're also a powerful leader within our community of behavioral health hospitals, bringing the hospitals together to deliver better care in general for the system. I would love to hear how you're doing that.
Wow. That was a humbling introduction. I think that when you have a passion about what you're doing, then it makes it easier. So I talk a lot about let's do the right thing and how are we going to be able to provide the best care for the patients that we get the privilege of serving. Yeah. And so as you're doing that, the pathway just kind of shows itself because as you're doing the right thing, you can tell that this is the direction to go in. And that's usually my focus is like, how are we going to be able to help people better?
Okay. So how many people does Dallas Behavioral Health serve?
We served over 9,000 people as far as the placing people into the continuum of care last year. In addition to that, we also touched the lives of 27,000 others because of the patients that were there, their family members, and their support system was also part of that help that we provided. So that's the numbers. I mean, our net is all of the Metroplex. We get people from Fort Worth and Frisco and over in East Texas all the way down south. So we help people all over.
So you have a tremendous reach, and from what I understand, to put this into perspective, the population of DeSoto is roughly 50,000, and you're serving 27,000. So the number of lives you touch across the entire state is roughly half of the number of people in DeSoto.
Yes.
And that's not even including all of the people you employ. How many people do you employ?
We have about 350 employees at Dallas Behavioral Hospital. And so, when you add them and then you add the people that we're helping support in the continuum, so like police officers and the other hospitals as far as the med-surg hospitals and all those different levels of care, PHP programs, IOP programs, RTC, so residential treatment programs, partial hospitalization programs, and intensive outpatient programs, and then any type of detox program. So when people get into crisis in any of those programs, that's when they'll come to us.
That's incredible. So tell me more about what a PHP program is and what an IOP program is.
So partial hospitalization program is the next level of care after you're in the intensive acute hospital. So when you go into an inpatient acute hospital like Dallas Behavioral, you're going to be there from 3 to 7 days, depending on how quickly we're able to stabilize you through groups and medications. And sometimes it's just like within yourself, you get to a place that you're not feeling the same way where you're a danger to yourself or other people or having those symptoms that make it that way. Okay. And then after that, you'll go to our partial hospitalization program, which is you come through in the morning time and then you stay for like 6 hours throughout the day and you're doing groups and going through group therapy and having some individuals, the psychiatrists are seeing you as well. And then so you'd stay in that program for around a couple weeks. And then after that, you'd go to your intensive outpatient program, which is 3 days a week as opposed to the partial hospitalization program. And you're not there as long. So you're there about 4 hours. And in addition to that, the next level would be medication management or just like a management where you're going and seeing your therapist every other week, once a month, depending on what your needs are. So that's the continuum of care.
So you support people from all kind of levels of need throughout their care continuum. So you can really walk through this experience with them, but you're making it to where they don't have to stay in the hospital any longer than they actually need an inpatient hospital. Then they can go home and spend some time with their family and at their own home, but still receive the treatment they need.
Yeah, because part of our responsibility, and this is something I take very serious, is you have to be a good steward of dollars. So I don't want you to be in the inpatient setting longer than you need to be, because the dollars associated with being in that stay are far more than a PHP program or an ILP program or med management where you're just coming through.
That makes it much more reachable to people too. Yeah.
In a perfect world, everybody's on the level of where there's trust amongst ourselves as the service providers, and then with the payers, so that you're able to advocate for the patient to get them the help that they need, and then hopefully they don't come back to the inpatient side, right? Because they're stable and they're visiting their primary care provider for the mental health services.
Okay. Yeah. So tell me, when you say patients, adults, children?
We help children as young as 5 years old all the way up to geriatric folks. So we have 116 beds, and we're able to, usually we have about half child and adolescent and half adult and geriatric. But we have the capability to ebb and flow depending on referrals.
Okay, so children have other needs. They have schoolwork needs and recreational needs. What do you do about that?
We work closely with the Dallas Independent School District. They were just here. It was yesterday. Okay. There was about 10 different folks that came through and toured the hospital, and we provide the learning that they'll need while they're with us through the ISD. Well, and then we do rec therapy. So we have activity therapists that provide groups. Good. And we have therapists that we do lots of groups.
Yeah, I was. When I toured your facility, I was impressed. You have a gym with a basketball court. So you're really pouring into their physical education, their schooling, and also their psychological health all at once, so that they don't lose track at school. No. And they don't lose track physically. And so you're looking at the entire individual, which I think is fantastic.
No, you have to have the whole wheel of what's going on within that person, right? And if you can touch all of those different spokes in the wheel, then you're going to have better care than if you're not doing those things. So
sure. So you're incredibly focused on the safety of your patients.
Oh,
and safety minded with it.
Yes,
absolutely.
Yes. Okay. We just had our patient safety survey. So that's where our staff members go through and say, hey, this is how we feel about the safety here. And our results were very positive. And I was so proud as I was reading through to hear that our staff feel that what we're doing is impacting the patients, and it's making a difference in what they're trying to accomplish too. Because for a long time I was a mental health technician, so that's the person that rounds and that is working with the patient the most, right? And so you have your tech, and then you have a nurse that oversees the tech, and you have a therapist that comes in and does groups, and you have activity therapy that comes and does groups, and then you have your doctor. And so to be able to hear from all of them all the initiatives that we're doing and all the focus that we have on patient safety, that they feel it. Yeah. Like that was amazing. I was very proud.
Well, before I talked with you at your facility last week, I spoke with some of your staff while I was waiting on you.
Oh, wow. Okay.
Michael, who's been there since the doors opened at the facility, said that he's seen great changes in the staff camaraderie since you've been there, and just really is appreciative of you do all kinds of things. Can you tell me what you do for your staff?
Well, I really try to focus on a work family. Yeah. So, there's been lots of different things that we did, but the first thing was we developed this diamond program. So if you're caught doing something the right way, then you're nominated for a diamond. And I actually have one on my badge right here. So in our town hall meetings, there it is. So in our town hall meetings, what we'll do is we have those every other month, and I'll have my list of diamonds, and we'll talk about exactly what they did in order to earn their diamond, and we'll recognize them in front of all their peers. And so that was one of the things, is like, let's all recognize when somebody does things the right way. And so the diamond program, we employee of the month, but everybody kind of has that employee of the month thing. But it's an important thing to focus on, is, this person is somebody that has done a great job, and these are the reasons why. And so we initiated that. We did this thing where I was at home and we were getting ready to go to school, and we had just purchased a bunch of school supplies for my kids, and I was thinking about the cost of it all, and I was talking about it in my morning meeting with my team, and I'd mentioned, this was a lot of money, and my HR director, Denise G., she was like, why don't we try to raise money to help our staff with school supplies for their kids? So we were able to raise through our vendors and through donations enough to purchase backpacks and supplies for 30 of the children of our employees.
That's incredible.
No, I was pleased. It was good.
So not only are you a family, I mean, you have potlucks.
Yes.
Jesus, your business development director, was telling me a lot about how you have potlucks. It's a family feel, and I could just feel that with your staff.
Well, thank you.
Yeah, but you also support their families.
Yes. No, it's one thing to talk about it. It's another thing to actually do it and have the actions that are associated with your words. And so that's one thing that we're doing, is we're really developing that culture of work family. Another thing that we talk about a lot is see something, say something. Okay. So if you see something that isn't right, I want you to say something.
Yeah, you're big on transparency.
Yes. I want you to say something to me. I want you to say something to your supervisor. I want you to say something to each other. Right? Because we're all human beings, and it's hard in the moment to maintain everything. And if someone's struggling, then you should go to them and support them and talk to them about, hey, let's talk for a second about what's going on, and support them.
Yeah, so you have a very approachable leadership style.
Oh, yeah.
Which helps you to create a culture of safety.
Yeah.
Perfect. Yeah. So I've heard a lot about a psychiatry crisis in Texas and in America. What do you think about that?
I think that probably one of the things that we need to focus on is how do we fund mental health services. Okay. So, it depends on what state that you practice in.
So where does Texas fall?
Texas is number 48.
Ooh.
So if you look at per capita dollars, Texas spends about $40 per capita. And a state so I grew up in Montana, then I worked in Seattle, and then I worked in Wyoming and in Utah. Washington was $117. Texas is $40. And Washington is at number 20-something, and we're at number 48. So
you're telling me that we spend roughly a third of the amount of what Montana spends on mental health per person?
Washington
does,
yes.
per person.
Yes, about a third. So that leads to some of the problems we have with capacity.
Okay.
So when I sit and talk with my peers about the need versus the capacity, there's this debate going on, is how do we fill all this? And I always talk with them about, it's not a capacity problem, it's a funding problem. Because if we had more funding, then there would be more capacity.
So a lack of funding, which is really what it is, right? Yeah. Means that we don't have enough inpatient psychiatry services here in North Texas. Have you seen any facilities shutting down or losing the number of beds they have?
Yes, Timberlawn closed.
Wow.
So, that was right down here, and it was in Dallas. We've had two of the Sundance hospitals closed.
Wow.
There's been some others. I can't think of their names right now, but yeah, it's hard. If one of my friends, Sherry Kuzmano is her name, and she works for Green Oats, and we were sitting talking about this, and she made the comment that if you don't fund services, they go away.
So if they go away, what happens to our society? I mean, do you see any problems, any bigger problems in our society if people don't get mental health inpatient treatment?
Of course. Yeah.
What can you think of?
Well, what will happen is it will turn into a med-surg problem as far as where are we going to provide services for these folks that need it, because there won't be beds and there won't be the people doing it on the behavioral health side. So people will still go to the emergency department. They'll be in Parkland. They'll be in all the HCA hospitals, Bear Scott and White hospitals. Yeah. It'll just move because mental health isn't going away. Right? Yeah. You have, in my opinion, I think everybody struggles from something, whether it's anxiety or depression or self-esteem issues or issues with drugs and alcohol. Everybody has something that we're coping with and we're dealing with. Right. It's folks that aren't able to cope and deal with those things that end up going into a psychiatric hospital.
So and then you think about if people don't get the treatment as effectively as they could, I think that it might cost more to deliver care in other places.
No question.
And so if we don't have enough funding for the inpatient psychiatric facilities, do you think that it would actually cost Medicare and all of the private insurance more overall?
Yes.
It's just a shift of where it costs them.
Yes. Yeah,
okay.
Exactly. Yeah.
Huh.
Yeah.
So it seems like they would want to fund more of it.
You would think so, right?
Okay.
And some of this too is the Medicaid expansion, right? So Texas voted not to do Medicaid expansion, and that's something that I'm hoping that we can relook at as a community and kind of put the pressure in the right places in order for all of us to look at how do we do this and what would be a model for what we could try to implement as in this state.
Sure.
And so, I'm working hard with other leaders in the community to try to get that message out as this is what we need to fix, this thing right here, and then making sure that everybody is talking or singing from the same music.
Sure. So tell me what that looks like. I mean, to me, it seems like you've met with other inpatient psychiatry CEOs, possibly the Texas Hospital Association. Who have you met with in the last month on this?
All of those. Yeah.
Okay.
And then some of our representatives and county commissioners and some of those political people that are involved with it as well.
Okay.
And I personally think that it's going to be something along the lines of looking at the waiver or expansion or some type of Medicaid funding or some type of an emergency funding for people that are in crisis and having a pathway of this is what we would do if somebody needed this. Right now, that's really not what we do in the state of Texas.
Sure, but we fund all kinds of other crises in healthcare.
Sure. Yeah.
Okay.
It's not perfect. The system is something that we all need to continue to work on and continue to be vigilant for our patients that are in need of those services. Here's the other piece of that too. So if I am chronically mentally ill and I have schizophrenia or some other disease that has got so bad that I've kind of ruined my support of my family or my family's not there anymore and I'm an indigent person or a homeless person because my illness has made it that way, how is it that I'm going to keep up with the documents that I need in order to make sure that I have insurance?
Oh, so you think it would be harder for somebody with some of your conditions to actually even approach the healthcare system?
Yeah.
Okay, and
my family can't keep track of me. Right?
Right.
I mean, so how am I going to make sure that I fill out that documentation or that whatever I need in order to be able to? It doesn't happen.
Well, I think that the number of pieces of paper you have to deal with when you're dealing with an insurance company is already dizzying.
Oh yes.
You can hold down a great job and you're
Yes.
And so I can imagine it would be harder on them.
Yeah.
I also just think, gosh, every time I pick up the paper, I'm hearing about a school shooting. I'm hearing about some other kind of tragic event. And I wonder how much of that is caused by mental health.
I think that majority, if not all, because people who are stable and who are making great decisions wouldn't do something like that. And they have great support as well, right? So we have failed as a society when somebody has gotten to where something like that happens, because I would hope that we could have some stopgaps in place so that we're supporting that person and helping that person and getting them on the path of coping with whatever they're coping with, so that it doesn't turn into something like that,
Sure. So
sentinel event.
Yeah. So you and your staff are the support for that, basically.
Oh, yeah. Well, and then not just us. There's the police department. There's all the hospitals. There's all the churches.
Sure.
There's schools. I mean, what we're trying to accomplish, it's more of a everybody thing, right?
Yeah.
And so, when that teacher notices that kid is being isolated and how are they able to, or bullied or whatever is going on, how do we intervene? And what are we doing to get that kid the services that they need before it turns into something else? Because a lot of that is either I was bullied and now I'm mad in this and now I've done these things, or I have some type of mental illness that I wasn't getting treated on and now I've done something like this.
Yeah.
Those are usually what you read about when you get into the details of the why.
Sure. So that's why you're partnering with the school district to basically to identify children who could use your help.
Yes.
And create pathways for them to be found by you.
Need.
Yeah.
Yes.
And so I was thinking about how people reach out to you, and I saw that you have a call center.
Yes.
Yeah. So tell me about that. What does that look like?
The call center is they just 24 hours a day, 7 days a week. We have people that are ready to take that call and to talk with them about whatever they need in order to be able to get the help that they need. Another thing that's just happened recently is that we now have 988.
Okay.
So 988 is like the 911 for mental health. If you're feeling suicidal, you can dial 988 anywhere in our nation, and a professional will be there to help you. This is just like over this last week.
Wow. So that's really breaking news.
Yeah,
oh my gosh.
Yeah, no, it's a big deal.
Yeah.
Because, the amount of suicide that happens in this country is astronomical, and it's something that usually if you have someone to support you through that and is there for you, you get through. Right.
So if somebody dials 988, is there any charge to or to you? Is there any charge to them?
No.
Okay. So if I call you, there's no charge.
No.
Okay. And then another thing that I think people think about is, would you have to report it to my work?
No.
Okay.
HIPAA. So HIPAA protects us all from our medical records, right? So I'm not going to call and talk to your work, and just like a med-surg hospital, you can't do that unless you do a release of information.
So it would require my permission in writing,
of course, yes,
for you to talk to my work about it. Okay. Yeah. So I'm safe in that you're not going to go gossip to my work, and that I don't have to pay you. So if I'm in crisis, I can reach out to you.
Yes.
Okay.
Most definitely.
Great.
Yeah, and there's systems everywhere as to we're here to support you, and that we are getting that right as a country. Right. Because there's other places in the world that they don't
have
that.
a system.
No.
Sure.
No. Is it perfect? No. So that's why we should all work to make it better.
Okay. So what you're asking, if you could ask legislators for anything, you would ask them for more money for inpatient psychiatry?
I think that I would ask for not just inpatient. There's also Texas, right?
Okay.
25% of the people who live in Texas are unfunded, which means they don't have insurance.
So wait, hang on. Stop the press. 1 out of 4 Texans do not have any sort of insurance at all.
Yes. Yeah. So it's not just a behavioral health problem. It's also a med-surg problem. So when I sit there and we're all together in these hospital meetings, Baylor Scott and White's there, and HCA is there, and Methodist is there, and it's not just my problem. It's also a medical problem. So I would like to focus on how do we structure something so that people could get a fund insurance for if you need medical, you have insurance. If you need psychiatric help, you have insurance. If you need prescriptions for whatever. That's really state of Texas wise. We need to look at that 25% and what do we need to do to fix that for that 25% of our people.
I suppose that's why Texas Hospital Association was meeting with you, is to talk about what can we do about this massive problem that Texas has.
Yes.
And that's why they're advocating on behalf of all the hospitals to do that. Mm-hmm. Okay, so, I was reading the other day that the vast majority of bankruptcy in America happens because of healthcare costs.
Yeah. And
that to me is incredible. So you think this might help with some of the bankruptcies?
For sure, because if you had a funding source, if I'm one of the 25% and I go and snap my leg, I'm going to catch that bill, right?
Sure.
And you're talking about if with a broken bone, they're going to go in and have to do some type of surgery to connect everything together, which that's $50,000 or whatever that bill is associated.
And who
with
has that lying around, right?
Yeah. And you don't have insurance in the first place.
Sure.
So, right.
So you're more at risk for not having that around.
And one of the pieces that I've learned through working in this industry in healthcare, because I'm a nurse, is that a lot of the people who don't have insurance are young people.
Wow.
Because once you hit 26, you're done with your parents' insurance, right?
Sure.
So you're 26 years old.
And you're just getting your start on life.
Yes.
So you're just starting to work. So you don't have a whole lot of expendable money, right? And then the gig economy, I think people sometimes take a lot of part-time jobs at multiple places. And so then they don't have a full-time employer with full-time, insurance.
Yes.
As an option.
Yeah. Or you get married at 22 years old.
Yeah.
And you're not eligible to be on your parents' insurance anymore because you're married. Mm-hmm. And you're 22. So how much money are you making as a couple? And so that there's a lot of that generation or that age group of people, the 20s and 30s, that don't have insurance, but it's life circumstances stuff.
Yeah. So with life circumstances, they don't have insurance. Mm-hmm. And then if they have some sort of health problem, and a percentage of people will, then they will, fall into either massive medical bills, because we didn't even capture that in the percentage, right? Or bankruptcy.
Yes.
And so then they file for bankruptcy. I think that would be a depressing event.
Oh, yeah.
Right? And then they have to come see you.
Sure.
Right? But there's not enough funding for facilities like yours to handle the problem.
Yeah.
So this is a huge problem.
It's a big deal.
Okay. And I think that's why all of y'all, all the CEOs of the inpatient psychiatry facilities are meeting together to try to figure out what your recommendations as a group would be to the state of Texas.
Yeah. It's not just us, too. It's the med-surg
and also the
leaders as well.
Acute care and critical access hospitals are meeting with you, too.
This is a large problem, especially in the state of Texas, because of the whole 25% thing. You don't find that in other states.
Yeah.
25% of our population does not have any type of insurance.
Wow. So I was reading the other day about small town hospitals shutting down. So you see this in rural America, and that drives economies for rural America, right? But you also are feeling it in the big city.
Sure.
Because y'all are the Dallas Behavioral Health Hospital.
Yes. Yeah.
Yeah.
And that's gonna. Sherry said it best. If you don't fund services, they go away.
Wow. Well, I think you're doing an incredible service for this area and really for the entire state. What great work. And I think that your entire staff seems like they're just pouring into it and they're pulling together to do it.
Yes.
And also the other leaders that you're meeting with. And because of that, because of your commitment to all of the community, we've decided to name a star after you.
Oh, wow.
Yeah. So we'd like to show you your star.
Okay.
So this is a look at your star.
There it is.
There it is.
That's awesome. Thank you.
So we'll send you a web link to your star. In the next week or two.
All right.
Yeah. Well, thank you so much for all of your valuable time.
Yes.
We really appreciate you being on the show.
I appreciate being able to come and to share my experiences and what the mission is right now.
Thank you.
Thank you.